Good evening all. I'm Aditi Lamba with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world is at 188 million cases of COVID-19 with now more than 4 million deaths. India, home to many of our viewers, has surpassed 31 million cases of COVID-19 with at least 412,000 deaths. A rise in India's COVID-19 infection rate is worrying authorities who are concerned that pilgrimages and tourism could prove to be super spreader events in the battle to avoid another devastating surge of the coronavirus. Here in the United States, we're at nearly 34 million cases of the coronavirus with at least 607,000 deaths. As vaccinations have slowed down in the nation, the Delta variant has continued to drive a rise in cases in now more than 49 U.S. states. Experts are saying that most of the new cases, hospitalizations, and deaths are among the unvaccinated people. In politics and more, the Biden administration has launched an effort which consists of relocation of thousands of Afghan interpreters and translators who worked for the United States. Many of these allies are currently fearful for their safety amid the U.S. troop withdrawal in Afghanistan. With this, it's now time to look at the headlines coming in tonight. U.S. Surgeon General calls COVID misinformation an urgent threat to public health. Dr. Bindu Balani, Hackensack University Medical Center, New Jersey. Haley Arceneaux to be youngest American and first pediatric cancer survivor in space, inspiration for Spaceflight, St. Jude Children's Research Hospital. Black Widow crosses $100 million at domestic box office, featuring cast and crew. Time for a short break on Vision of Asia South Asian News segment. Don't go anywhere, we'll be right back. And welcome back. I'm Aditi Lama and this is Vision of Asia, Thursday night episode of South Asian News. On COVID-19 updates and measures, cases of the coronavirus and hospitalizations have continued to rise across the nation, affecting states with low vaccination rates the most. Full-fledged outbreaks have been seen in states such as Missouri, Louisiana, Arkansas, Mississippi, and more. These states are facing full capacity of intensive care beds and ventilators in the hospitals and cases up to 70% in some. U.S. Surgeon General Dr. Vivek Murthy on this troubling rise in cases and deaths has attributed it to the misinformation about COVID-19 vaccine and the spread of the dangerous Delta variant. He said that the misinformation is a serious threat to public health. It can cause confusion, mistrust, harm public's health, and undermine public health efforts. He also said it's imperative to limit the spread of misinformation in the country and warned that American lives are at risk. On this and much more, we spoke with Dr. Bindu Balani from the Hackensack University Medical Center in New Jersey. Remember, you can visit vaccines.gov to schedule your COVID-19 vaccine appointment. Here is Dr. Balani. Big news came from the Surgeon General Dr. Vivek Murthy today when he called COVID misinformation an urgent threat to public health. My question to you is, do you agree with that? And what kind of misinformation are we talking about here?
So I think I definitely do agree with that, because I think the most important, the reason for the lack of people taking the vaccinations is probably the misinformation or lack of information thereof of these particular vaccines. So, we've heard various different comments regarding the possibility of use of the vaccines related to infertility or to leading the lack of this particular disease process being being prevented from the vaccine series, or a bot being put into your body, etc. All of those things are probably misinformations that are currently available in the social media that unfortunately has led to many of the people not wanting to take a particular type of vaccines. The lack of information on its efficacy or effectiveness against the different variants is yet another misinformation or lack of information that's currently available. Some people say, "Oh, you take the vaccine, you're still going to die," or how well does this vaccine protect you, etc. I think all of those information are still not 100% of times correct or valid in the various social media's messages that keep going around.
Right.
So I think that is the big deal.
Of course, he actually called on these social media platforms and tech companies and has kind of requested them to look through their misinformation so we can get more vaccinated. Doctor, let's talk about this rising cases of COVID-19. Almost 50% of states are more than 50% of states are seeing a rise in infections. Some are seeing a huge rise in hospitalizations. Some are seeing a huge rise in deaths. My question to you is, why is this happening at such a rapid rate in some states?
So I think it probably is related to the number of vaccinees or the vaccine status of that particular state, or even just a county, just like small pockets that we have around. I think that really does correlate very nicely to the graph of those who have the rate of vaccines. If you kind of overlap them to the rates of the rise of the vaccine of the disease state, we do definitely see that those patients or those countries and counties that have lower rates of vaccinations tend to have a higher rate of hospitalizations with severe disease. So I think it kind of goes hand in hand with what your current rate of vaccinations is in that particular county or state or hospital area.
Right. Experts are even saying, doctor, that there is a third new wave of coronavirus in some parts of the country. Some of the states that we're seeing really rising cases, and this third new wave is Missouri, Louisiana, Florida, Arkansas, and a few more. My question to you is, how bad can this third wave get? How can it affect vaccinated states?
So I think we would be a little bit protected if we are vaccinated, more so because virtually what we've seen is virtually all of these patients who get admitted to the hospital because of this second or the third rise, the third wave of this disease has been in unvaccinated populations. So hopefully in our vaccinated populations, we're going to see less of that particular steep rise. Are we going to see still some rise? Absolutely. Vaccines are not 100% protective. They're definitely very good in the protection in preventing severe disease, but you could still have mild disease, and you could still have a mild symptomatic or asymptomatic pickup of these particular patients who are vaccinated with this particular disease, but hopefully not to the extent that's going to require you to get into the hospital.
And this variant, doctor, the Delta variant of coronavirus, experts are saying that it's like COVID on steroids. Do you agree with that? And how is that truly affecting the low rates of vaccination as well?
So I think I'm not sure that it's actually COVID on steroids. I think what it is definitely has proven that we've seen in the other countries and states is the fact that it's definitely more contagious. So I think we're seeing a little bit more rise and a more rapid rise based upon the fact that the contagiousness of this particular variant is a little bit higher. It presents like a common cold more so than the severe shortness of breath or a cough that we're kind of, or fevers that we kind of expected with the first round of the GI series that we had with the first round of waves. So it presents like a common cold, like a stuffy nose, what you would normally see with just a rhinovirus or regular common colds. But the contagiousness and the possibilities of infecting more people faster is where the issue comes along. So you get to see a much larger cluster of cases from this particular variant rather than the prior ones. So I think that perspective is what's kind of worrisome with the rise in the numbers.
Right. So when looking at these states with low vaccination rates, plus the spread of the Delta variant, my question to you is, what should these local and state governments do in order to raise their awareness on vaccine and actually get more people vaccinated? Because it seems like the responsibility now lies amongst the people that are in the state.
You're absolutely right. I think the responsibility lies amongst us. We as the community are the ones who need to step up to be able to take this particular vaccine, because ultimately it is a global disease, and you can't just say, oh, you know what, I won't take it, my other XYZ person's going to take it and will help prevent the spread. But it's the unvaccinated clusters that are actually causing this particular wave to reoccur again. So I think stepping up, stepping forward, taking the vaccine to try and prevent this particular spread is what is going to be the most important way of trying to deal with this. Having ambassadors who believe in it, who have the right information, who are thought leaders, who are role modelers, I think are the ones who need to step up and kind of give their stories to people to make them understand as to why it is necessary. I think it's important not just for oneself to get the vaccine, it's also important to be able to protect your loved ones around you. I think it's very important message that needs to be told to the community related to the ability to not only prevent your own disease. You may be young, you may be healthy, and nothing may really affect you, or you may not have a negative impact, but maybe your parents living with you, or somebody who's on a cancer treatment, or is an organ transplant person who's got a second life after that organ transplant. Maybe those people who are within your community circle are the ones who are going to be impacted mostly, based upon even a small, strain coming through into that household. So I think not just for you yourself, I think it's for you and your loved ones that you need to really step up and take these vaccines.
Let's now take a look at Inspiration 4, a space flight planned for people aboard the SpaceX Resilience capsule in September this year. SpaceX Inspiration 4 will be the first human spaceflight to orbit Earth with only private citizens on board. Led by Commander Jared Isaacman, Inspiration 4 commemorates a 4-person crew raising awareness and support for St. Jude Children's Research Hospital. The mission here is to raise $200 million by 2022 for research and treatment of childhood cancer and other life-threatening diseases. Each of these 4 seats in the spaceflight features key pillars of support for St. Jude: leadership, hope, generosity, and prosperity. The seat of hope has been given to a pediatric cancer survivor and now a physician assistant at the St. Jude Children's Research Hospital, Haley Arceneaux. Excited about exploring space and its reach, Haley wants to bring more faith and strength for pediatric cancer patients and money to fund efforts in saving precious lives. Only 29 years old, Haley is the first pediatric cancer survivor and the youngest American to go into space and will serve as the crew's medical officer. We spoke with Haley on the impact of St. Jude on cancer patients and their recovery, along with her take on the preparation process for Inspiration 4. Here is the conversation. With your journey with St. Jude and now to the space representing St. Jude and the hope that's associated with it, what would you tell your younger self who got cancer-free at St. Jude about yourself and the space mission?
I would tell younger me that it gets better, that even though the cancer diagnosis and the treatment is so scary, hold on to hope that there are better days, because there absolutely are. And I would tell younger me the same thing that I now tell my patients, which is having cancer is going to change your life in a great way, and it's going to make you who you are, and you'll be stronger because of it.
Right. What do you have to say about St. Jude's progress over the years with cancer research? You're a physician assistant there, so you must have a lot of insight.
St. Jude has been leading the way for how the world treats pediatric cancer. And we'll continue. St. Jude won't stop until no child dies from cancer. And it's so important that it's fun. It's so important that the community helps support St. Jude, because the cures discovered at St. Jude benefit children all over the world.
Right. And let's now talk about the space mission. I'd like to know what the process has been like and what has been the most challenging aspect of it. Again, they're trying to raise $200 million for St. Jude's for a children's research hospital.
Training for space has been so much fun, and I love it because it's so different than my day to day, and I'm getting to do really all these once in a lifetime experiences. Probably the most physically challenging was we climbed a mountain as a crew. It was our crew bonding experience, and we spent 3 days on the mountain. But that experience in itself was so uplifting and so empowering. But just I have enjoyed training so much, and we're going to continue training until we launch in 2 months.
Right. What are you the most nervous about?
I'm really not nervous. And I think there's just so many different parts of the mission that I'm very excited about. I can't wait to see the views from space and to see the entire planet. I can't wait to float around, and I can't wait to call my St. Jude patients from space, because I think that's going to be very special for them and very special for me.
How important do you think is for people in general to, fund this effort?
I'm hoping that we can make our goal of $200 million raised for St. Jude, because that's going to help so many kids all around the world. And St. Jude is trying to improve pediatric cancer survival rates everywhere. But I hope to gain a new perspective from going to space, and to share that perspective and continue sharing it with my kids going through cancer treatment, and just show them that they can do anything they want to do when they get older.
Right. How does your family react to this, Haley? Because you guys have had a connection with NASA. Your brother is also a space engineer, if I'm right.
Yes.
Yes. How are they feeling? What is the momentum like?
They're so supportive and so excited for me. And then also they're so excited for St. Jude, because they love St. Jude as much as I do.
Yes, of course. Just talking a little bit more, I have a little bit time left with you here. What's the message you like to give to other cancer patients that are going to see you go into space? The amount of hope that's shown through that.
I would absolutely tell kids going through cancer treatment everywhere to hold on to hope, because it does get better, and to continue having a zest for life and enjoy every day. And yeah, that just to continue holding on to hope.
Well, it's time for another short break on Vision of Asia, Voice of the Community. Again, don't go anywhere. We'll be right back. And welcome back. I'm Aditi Lama, and this is Vision of Asia South Asian News segment. Produced by Marvel Studios' new American superhero film Black Widow has now crossed over $100 million at the domestic box office, making it the fastest to do so during the pandemic. Globally, the movie has crossed $200 million. Distributed by Walt Disney Studios Motion Pictures, Black Widow is the 24th film in the Marvel Cinematic Universe and has been directed by Kate Shortland with screenplay by Eric Pearson. In the movie, the character Black Widow Natasha Romanoff, which is played by Scarlett Johansson, confronts the darker parts of her leisure when a dangerous conspiracy with ties to her past arises. Now, Natasha must deal with her history as a spy and the broken relationships left in her wake long before she became an Avenger. We have tonight more insight into the movie featuring cast and crew of Black Widow. Here is the story.
I'm done running.
Natasha is a fascinating character, and I think fans wanted to know more about her. They wanted to know who she was kind of before she was an Avenger, but also she's so secretive often and doesn't trust people, and I think they want to know where that comes from. Excited to join the MCU. I'm incredibly excited about joining the MCU and working with these characters, and also just with the Marvel universe, and the people that make the movies. It's been a great journey. We learn in Black Widow that Natasha was part of a spy family, and that she was in Russia and then she was brought to America to play a role. And so that the character has always had to pretend. And in Black Widow, we sort of strip that away and we say, okay, who is she when she's not pretending and she's vulnerable and raw? And yeah, we get to see that within a family dynamic.
We're a family. We fight with you.
You won't win. I've always found it best not to look into the past. Okay, you got a plan, or shall I just stay duck and cover?
My plan was to drive us away.
I think fans have wanted a deeper dive into Natasha Romanoff's past, because she's such a mysterious, interesting character. And I think everyone wants to know her kind of origin story and what happened before she was an Avenger. I feel very flattered and honored to be part of the MCU family. It kind of does feel a little like family. Well, my character, Melina, was trained as a Black Widow in the Red Room. So I'm an older generation Black Widow, which Scarlett's character was too. So we come from the same school, from the same country. We've been through the same trauma. We've had the same training.
His call sign's Taskmaster. He controls the Red Room. They're manipulated, fully conscious, but no choices.
I should have come back for you.
How many others are there? Enough.
We have to go back to where it all started, so they never do that to anyone again.
I think that fans are eager to see more of Natasha Romanoff. She is really the only one of the original Avengers who hasn't had her own standalone movie. I mean, we got Thor, we got Captain America, Iron Man, Hulk. And, so it's time for Natasha's story to be told. And I think that, fans of these movies really want to hear more about her past, which has been shrouded in a lot of mystery, the Red Room and what she's been through as a human being. And I think fans are eager to see that. How do I feel about joining the MCU? I don't know how one could answer that question except awesome. It's really great. I mean, I love these movies, and I think that Marvel and the MCU do them better than anybody. The production of the movies themselves, the scripts, the characters are also rich and at the highest level. And then on top of that, you have this world of brothers and sisters, who are making the rest of the mythology, and that mythology is crossing over in weird, wonderful ways. So I don't know how I could possibly answer that question without simply saying, well, I seem to have said a lot more, but simply saying, I feel awesome about it.
With this, we wrap up the show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on our Facebook handle @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Diti Lamba. Take care and be well.